Something exciting just happened in the field of gynecology and endocrinology, and that is PCOS got a new name. Instead of polycystic ovarian syndrome, we now are calling it much more appropriately polyendocrine metabolic ovarian syndrome. This started, oh my goodness, over 25 years ago. We realized that women who had issues with not ovulating regularly, so it was often a fertility diagnosis. A woman would come in, irregular periods, trying to get pregnant. They discovered that on ultrasound, her ovaries had these tiny little cysts on them, and they called it a syndrome, polycystic ovarian syndrome. But the real issue was that she wasn't ovulating and her periods were irregular. Other symptoms are symptoms of too much androgens. So hair growth and then insulin resistance. That's one of the things we discovered about 25 years ago is these women had an increased risk of type 2 diabetes, and they definitely had insulin resistance with high insulin levels and borderline blood sugars. And interestingly, way back, we discovered that treating insulin resistance, either with metformin or even better with a low-carb diet, all of a sudden they would start ovulating again and their periods would get regular. So now, finally, we are calling it by its appropriate name, which is that it's a metabolic issue. And high insulin is one of the big factors. You see, when your ovaries are always pumping out, ready for the next cycle, as the cycle begins, the goal before menopause with these follicles is to ovulate. And what happens is 10 to 15 follicles start this growth phase, and it's a race. And whoever starts winning the race grows a little bit faster, starts to secrete these hormones to slow the other ones down so that they don't become what's called the dominant follicle and then ovulate. Well, this is a little bit simplistic, but what happens is high insulin prevents the formation of a dominant follicle. So instead of one follicle that ovulates and then disappears, you have all these, 1 centimeter, half a centimeter to 1 centimeter sized follicles that never develop into the dominant follicle and never ovulate because one of them isn't allowed to get ahead. So this is good news that we're finally calling it by its appropriate name. And it's good news because it shows that the treatment is to get the metabolism under control. If you have insulin resistance, you may have normal blood sugar, but in order to keep your blood sugar normal, your body has to make more insulin than other people. And it's the high insulin that's the problem. High insulin tells your body to store fat. High insulin leads to inflammation, increased risk of heart disease, increased risk of cancer. And we learned way back that these women who had polycystic ovarian syndrome had all these health risks. So now that we know that it's a metabolism problem and we can treat it, I really hope that that's good news for people to take control of their health with getting their blood sugar under control. It's not a character flaw. It's just a chemistry issue. If your body does not handle carbohydrates well, then eating the standard American diet or even a slightly reduced healthy American diet, with quote unquote healthy carbs still leads to the elevated insulin and leads to all the issues that go along with it. Our diet is so pronounced with carbohydrates. What are carbohydrates? Well, sugar and anything that turns into sugar as soon as you eat it. Starches, potatoes, sweet potatoes, bread, rice, any of the grains are very high in starch. Beans are higher in starch, but they're so high in fiber that their net carb load is a lot lower. So those are things to consider. If you have concerns that you could have polyendocrine metabolic ovarian syndrome, PMOS, you can get tested because there's blood tests now and laboratory data that we use to make the diagnosis. But even the most important thing is The irregular periods. It's such an obvious issue. If your periods are not regular, a lot of times that's the cause, some varying degree of this issue. There's other issues that lead to lack of ovulation, but that's a big one. Your menstrual cycle is a sign of health. If you're not cycling regularly, it could be polyendocrine metabolic ovarian syndrome, or it could be high stress, other things. So the cycle is certainly an indicator of health in women, of fertility years. And PMOS is an indicator of dysfunction, and that leads to the irregular cycles. If this is you, get help. The good news is that there's ways to treat this without medications. You don't need fertility drugs necessarily. You might, but I would certainly try to get a hold of the metabolism and the inflammation issues first. Those are the most important things. And a lot of times, if you do those things, body corrects itself, and then you don't need all those expensive side effect medications. If it's possible to heal and not use medications, that's the best way. I'm Dr. Yvonne Karney. I'm the Hormone Locksmith. This is important information. Send it to someone who needs to hear it, and take my hormone quiz. If you're struggling with a lot of symptoms and you're not sure if hormones could be involved, take the quiz and it will give you some good information.